When we think of injury screens, sometimes you get people that are a high school level athlete or a collegiate level athlete and they don't have an exact injury yet, or maybe they've had an injury in the past and they just want to be preventative. So meaning they're going back into their sport or they want to play harder in their sport and they want to know what is it that they could do differently that can protect them down the road in the future. Also, what can they do differently that's going to propel them down the road in the future? It's going to make them a better athlete. That's what we think of as injury screens. What are the things that they're doing movement-wise, performance-wise, that maybe they don't realize they're compensating or they don't realize they're underutilizing a certain muscle group, but we have the tools and ability to see that, and we can start telling them, this is what you're doing, this is what we're going to do to help correct it, and then these are the exercises, the appropriate functional exercises you're going to do to prevent it from ever happening again. Hands forward towards me. Good, and now lean forward so your wrists are even on your shoulders. Catching people young, 13, 14-year-olds, I mean, their growth plates haven't fully fused at that point. That's when a lot of very advanced training comes into play. So if they have compensations at that point, if they have weaknesses at that point, and then they're being hit with a really hard workout schedule, I mean, that's when you need to intervene when they're young. They need to develop that foundation early on.
I think in particular with, younger kids, they won't feel pain immediately because they are so resilient, but it can be doing damage that if you're not properly supervised and if you're not strengthening your whole body and your whole leg and foot.
A lot of hard work. It's a long event. 10K it's a 2-hour event, so it's the equivalent of a marathon in the water. Otis Maluli, Olympic gold medalist in swimming, open water Olympic gold medalist in London, and 1500 meter freestyle Olympic gold medalist in Beijing.
Yes, the hand is slightly higher. Can you lift?
Obviously for swimmers, our shoulders bug us a little bit, so a lot of shoulder griddle stability type of stuff. But yeah, the suspension cord doesn't only deal with just shoulder stability stuff. It's really like a full body type of treatment. That's you just have to hop in there and try it to see what it does to the body, because it puts you in a situation that no other equipment can really stimulate you that way. So.
And a lot of this information is not a coach or trainer's responsibility. It's really what we learn as movement specialists and as physical therapists. So someone say a young kid coming in with a common foot position we call foot pronation. So maybe that kid doesn't have an issue now, but we know down the road what having the foot in that position could possibly do up the chain in the body, what stress it's going to put on different parts of the knees and the hips and leading to the back. So he might not be injured now, but coming in down the road, he could start to develop things. So intervening at a young age, starting to address why his foot is pronating and starting to look up the entire body and what you can start changing and training and turning on in that little developing body, you're going to start to give him, again, a better structural base, a better position to carry loads in his body so that he doesn't end up with injuries 5 years down the road, which could happen.
I played professional soccer. I taught yoga to the Galaxy here in Los Angeles, and myself, I recently had a meniscus tear in my left knee, which needed surgery. And recovering from that, I went to Posture Works because we were able to find why that injury occurred. My hips and my glutes weren't firing. The motor pattern was off. And by correcting that and relearning, I'm preventing so many injuries in the future and upping my level of play now. I would have loved to have this kind of work in high school and in college when we were really, really pushing ourselves. Not only would I have performed better, but all the injury prevention and probably the years of pain that I've had post-professional athletics.